This is an instructional video on how to perform Dr. Toriumi's antibiotic saline irrigations. These are commonly placed in patients who have previously had rhinoplasty procedures in order to prevent infection. These are very easy to perform, and we will demonstrate this shortly. These are typically left in place for approximately 3 to 5 days, and then they're removed in clinic. It is as simple as clipping a suture and pulling out the catheter, which we will show you. There is no pain associated with this. This catheter will already be previously attached before you wake up, and it will look something like this, where this is going underneath the nasal skin and it's sutured in place, connected here, and this tubing is going to be used to infiltrate the saline solution, which will go underneath the nasal skin. This portion hanging out at the end is where you're going to attach your syringes that either the post-operative nurses will give you or our clinic will provide for you. These are 1 cc, so this is a small amount of solution. The same antibiotic solution that you'll make up with the ciprofloxacin that you'll be doing your antibiotic soaks, you'll also use for your saline irrigations. What you'll do is each time that you're going to do this, you'll shake up the solution to dissolve the ciprofloxacin in the saline. You'll open it, and into a clean cup, which should be provided, you can pour a little bit of the solution. Every 3 hours, what you're going to do, depending on the number of tubes that you have, is you're going to draw up some of the solution, as such, to the 0.5 mark. You're going to gently insert it, and when you do so, under some pressure, you're going to twist. This should lock it in place so it stays. Once that's in place, you're going to gently take the solution and go very, very slowly by pushing down here over the course of 5 to 10 minutes. The reason that you go very slowly is so that you don't get any pain or discomfort during this. If you do have that, it usually means that you're going too quickly and you should slow down. This should be relatively easy and painless to do if you are doing so correctly. So now we're going to demonstrate how you will actually hook up the syringe when you're at home. Typically, patients will either have somebody help them do this, or you can do this in front of a mirror. So this is how the normal setup will look. She's demonstrating 1 drain. Again, this is going to be sutured to the inside of the nose. That will be done already before you wake up. That's the little catheter, and here's the IV tubing that's secured with tape. Now, for demonstration purposes, we have a bit more tape than we'd put normally on the patient, but this is to show a rough idea of how this is done. Again, you may have multiple drains on one side or them on both sides. Again, this is what it will look like. These typically stay in place for about 3 to 5 days. Then they're simply removed in clinic by clipping a suture on the inside of the nose and sliding that very thin catheter out. Again, this does not hurt and takes only a few seconds to do. So what you're going to do is draw up your 0.5 of your antibiotic solution, and at the end of the catheter is going to be this spring-loaded site. You're going to take this and gently take the end of your syringe, apply a little pressure. You'll know that you've done that because you can apply some gentle pressure by pulling back and it won't come off. Then, very slowly, over the course of 5 to 10 minutes, you're going to push the end of the syringe, and it's going to put the solution through, drop by drop, underneath the skin. Again, you should go very, very slowly so that you don't get any pain or significant discomfort. Once you've done this slowly over the course of 5 to 10 minutes, simply twist and leave the drain.